Hello, I'm going to talk about coronary artery disease. For the coronary artery disease, I'm going to talk about it into four parts. The first part is the introduction. The second part is patterns. The first part is contributing factor. The last part is drug used for treatment. And for the introduction, coronary artery disease occurs when the heart is suffering of oxygen because the arteries and of the heart do not receive enough oxygen-rich blood. It will cause chest pain, shortness of breath, tightness, heart attacking, and also will causes death. It is also the second in the top 10 causes of death in 2021. Of the coronary artery disease, there have four different patterns. The first is congenital heart disease. The second is rheumatic heart disease. The first is hypertensive heart disease. And the last is coronary heart disease. And for the contributing factor of the congenital heart disease is unknown reason. Why I will write it unknown reason is in nowadays the scientists is still can't find out what reason that will make the congenital heart disease happen. So there have no reason of it. And for the rheumatic heart disease, the reason is the people staphylococcus infection, but we have to know that is not all the people will happen this heart disease when they staphylococcus infection. So we have to know that not all the people will. Just only some of the people will happen of this. And for the hypertensive heart disease, the reason there have two reasons will make it happen. The first reason is the left ventricular hypertrophy leading to heart failure. And the second reason is arteries narrow due to the heart blood pressure. And for the coronary heart disease, the reason will make it happen is a build-up of fatty platelet in the arteries of the heart that reduce blood flow to the heart muscle. And in stand still, I have shown a picture that how the fatty platelet build up in the arteries. And for the left hand side of the picture, it is showing out normal arteries, and of the right side of the picture is show that when the fatty platelet finish build up in the arteries. And next part we will talk about the drugs of use for treatment. And the first drug I'm going to talk is the nitroglycerins. And use of drugs administration is PO, IV, and sublingual. And effect of it, there have two effects. The first effect is low dose multiplication, and the second is high dose multiplication. First of the low dose multiplication is dietary fans and to reduce the heart demand for oxygen, and for the high dose multiplication is dilate the arteries and to reduce the load of the ventral during surgery. The next drug I'm going to talk is the beta blocker. Route of drug administration of beta blocker is PO and IV, and the effect of this is blocking the beta receptor can reduce the excitatory effect of sympathication of sympathetic nerves on the myocardia, thereby inhibiting cardiac activity and reducing the load and the oxygen demand of the heart. And the next drug I'm going to talk is calcium channel blocker. Of the role of drug administration of calcium channel blocker is PO, and the effect of this is dilate coronary arteries, peripheral arteries, and arterioles to reduce ventricular diastolic load. And the last drug I'm going to talk is antiplatelet. And the rules of the drug administration of this is PO, IV, and rectal administration. And the effect of this is inhibit platelet function and prevent blood formation and creation to reduce the chance of the myocardial infarction. This is the end. Thank you for listening.